I'm joined by Brad Skennerton, a therapist and social worker with over a decade of experience supporting individuals and couples through trauma, emotional challenges, and life transitions. He specializes in acceptance and commitment therapy, guiding people toward greater psychological flexibility and a life that reflects their values. Brad's approach is grounded in compassion and a trauma-informed perspective, creating a safe space for healing and growth. Here is my interview with Brad Skennerton. Hi, Brad. I just wanted to say thank you so much for joining me here on Two Healing Minds. I really appreciate it.
You're so welcome. It's a real privilege to be here. And yeah, I appreciate the opportunity to speak into all things attachment and relationships related. So yeah, thank you for having me.
Yes, well, actually, that's a perfect place to start. Can you explain what's meant by attachment trauma?
Yeah, I'd love to dive into that. Would I be able to just talk about what attachment is, just to help your listeners get a sense before we touch on the trauma? Is that okay?
Yes,
Um,
yes.
so yeah, so the way that I like to sort of explain attachment is it really is like the subconscious set of rules and beliefs that we have around love and connection. And so it's kind of like our internal working model that becomes the blueprint. So our early experiences do it during our sort of formative years from 0 to 2, that we kind of get that through that mirroring, that what wires together fires together from our parent or our caregiver. And so as the parent approaches the child when there are cues of distress or needs that need to be met, we really need our parents or caregivers to be our safe haven, our secure base, to feel loved, valued, supported, responded to, etc. So when that doesn't happen, and when that comes into question, and perhaps when I think about attachment trauma, often there's been a lot of inconsistency. Maybe there's volatility in the home. There might have been a lot of instability. So parents may not be reliable for various different reasons, scary or even frightening. And so it really does put a young person in a really difficult predicament because, as we know, the brain and the nervous system prioritize survival over connection. And
Mhm.
so the nervous system and the brain becomes wired to stay in connection with mum and dad because if I'm not in connection with mum and dad, I'm at existential risk of death, really. Children are vulnerable. I might not be able to care for myself. I can't feed or clothe myself, etc. So it is a really challenging predicament for a kid because if mum and dad are kind of scary and frightening or even the source of the harm, it's like I kind of want to come close to you and seek comfort and reassurance and have my needs met. But the very person that I need that from is also the source of my fear and distress. So often I find, and I would say that sometimes folks do have attachment trauma that may not have this particular attachment style, but commonly those that have had those experiences may have a more what we call fearful avoidance strategy. So that can be that sort of like wanting to come close, but then also fearing emotional intimacy and connection. And so there can kind of be a sort of hypervigilance around it, and also maybe a sort of freeze response and a sort of wanting to pull away and to shut down as well. Is that kind of making sense?
Okay, yeah, so it's a child's survival instinct. It's supposed to be
Mhm.
something natural, but that's not necessarily always the case because of the
Yeah.
dynamic of the parent-child relationship,
Yes.
right?
Yeah.
And because
Yeah.
yeah, we're just trying to understand that and how that forms when they become an adult, how that impacts
Yes.
them once.
Yeah.
Yeah, like for instance, like how does that experience that you're talking about, attachment trauma in childhood, shape the way that people form and maintain their close relationships later in
Mm.
life, as I was saying, as an adult, with it, whether it's a partner, family member, or a friend?
Yeah. Thank you, Tanya. That's a great question to follow up with. The way that I think about it is it actually carries a lot of weight. It's very hard for us to then, because when we think about it, going back to what I said earlier around the blueprint, right? Like it's our
Mhm.
internal working model of what we expect in relationships. And so it can be very difficult for those that have had those earlier experiences to really fully trust that people will show up and meet my needs, that people can be safe. Like I filter the world through the lens of my early experiences. And so often, folks that sadly have had these experiences may have a lot of difficulty with emotional vulnerability, because when we think about like the parent or the caregiver being frightening, unsafe, so maybe like domestic violence, substance abuse, or a lot of sort of chaos, neglect, that kind of thing. If that's been the case, vulnerability has not been safe. It's not been safe
Mhm.
for me to be vulnerable and know that I can trust that a parent will really help me soothe and I can safely express my needs. So that then translates, of course, into adulthood where they don't feel safe with their partners. There's, like just sort of thinking about particularly a fearful avoidant sort of attached person may feel a deep core sense of unworthiness, a deep core sense of shame that permeates their being. They often might reflect in my sessions, Brad, am I broken? Am I like, is this what it's like? Like, am I just going to stay this way? And it's difficult for them to lean into hope or to really see that can change. But I do want to put a preface in here that you absolutely can heal, that it's completely possible by simply by virtue of neuroplasticity of the mind. We can rewire and fire new neural pathways and move towards a place of earned security.
Okay, so this is mostly for obviously people that have had that unstable childhood
Mm. Mhm.
and where there
Mhm.
hasn't been that love or that attachment or that care or that nurturing. So it's
Mm.
lacking in all those areas.
Yeah. Can I add to that, Tanya?
Oh, yes,
I think
absolutely, absolutely.
Yeah, there's a thought that's coming to mind for me as you reflect that. And I do want people to know that you can actually have a really safe and secure parent. And if you were repeatedly subjected to somebody who harmed you and the parent was unaware, you can still have attachment trauma and you may even still have a fearful avoidance strategy. So I just want to put that nuance in there because I think like everything that I'm touching on today isn't really about blame. I'm not trying to sort of blame parents, or I understand that a lot of clients and folk in general, want to stay in connection with their parents on some level and that kind of thing. And so it's not so much about, you know, pinning blame to parents, but more about giving clarity to your past and showing how that shapes the present and then empowering people to take back charge over their lives and to feel safe and benefit from really healthy relationships.
Yeah, and absolutely. There's always that potential for change and obviously for healing and to kind of change the course of your life, whatever you've experienced, to work on it, to work on the issues, as you say, right?
Yeah, yeah,
And,
absolutely.
but so, I mean, this is for adults. If someone has experienced, betrayal in their life or abandonment by a loved
Mhm.
one,
Mhm.
what are the early, I mean, loved one can be anyone, parents, spouses, relationship partners, or it can be anyone actually in the family group, relatives, friends, anyone. And what are
Yeah,
some early signs that they still may be carrying that emotional injury into current relationships? And again, when I say
yes,
relationships, because people automatically think, oh, it's like spouse or your significant other, but it can be anyone, just friendships,
yes.
anything. Yes.
Yeah, I love this question. And I appreciate you sort of expanding the landscape there. You're right, betrayal can happen in various different sort of dynamics. And I guess what I think there's a couple of ways I want to answer this. So um, I think if it's kind of more early betrayal and it's maybe something in terms of like, say a child with a parent and the parent's been the source of harm and abuse and that kind of thing. Um, it can be difficult for that person to then establish trust and safety a few components that might be really important about that is, can the person who impacted the harm really understand the impact of that, really hold you with empathy and accountability, and really recognize that. And I think like one of the hallmarks that people tend to experience with betrayal trauma is a sort of hypervigilance in their nervous system. Any kind of cues of distrust that remind them of the impact of that injury in the first place will, often provide like, oh, sorry, bring them to a place of emotional flooding, hypervigilance, panic, very similar actually to those that have sadly might have a PTSD diagnosis. So you might have intrusive thoughts, you might have flashbacks, nightmares, avoidance. So experientially avoiding what then triggers you. You might even find yourself distancing from the person, or even if maybe the harm happened a long time ago, it might be really difficult to lean in and sort of have a healthy dynamic with that person unless there's been repair. Um, and so just to expand on that, like when I think about maybe what you're touching on before, more in a spousal dynamic or relationships that are romantic, of course, like one of the most common betrayal injuries is infidelity.
Mm-hmm.
And I also want to preface this that betrayal doesn't necessarily look like infidelity. It can be maybe the partner is in a very vulnerable moment with their mental health or in the hospital with a health condition, and the partner didn't show up for them. And so it
Yes.
really brings the ground of the relationship, the foundation that it sits on, it brings it into question. It's on shaky ground now. The
Mm-hmm.
bond has a fracture in it. So it's like there's been a break in the bond. And I kind of think about it a bit like, like a broken bone.
Mm-hmm.
So I think what often, just to circle back and hope I'm answering the question, when I think about, more in that spousal dynamic, often the partner might again sort of have a lot of hypervigilance, might be sensitive to maybe when, say, the partner, like if it's an infidelity wound, maybe the partner's just happens to be looking at their phone and they've put it down as the partner's walked into the room, and the partner might sort of think, oh, they're at it again, like they're going to cheat on me. And so they might very quickly drop into that sort of trigger that floods their nervous system and takes them right back to that place of not being able to trust. They might ruminate a lot on that. So really questioning the self around what did I miss? Like, how did I miss this? Like, how could they do this to me? Like, there's a lot of intrusive thoughts that kind of tend to percolate in that person's mind. Um, they might, like it's particularly with maybe those kinds of wounds, you will find that maybe the hurt partner that's experienced that wound will tend to want to revisit that a lot. Like that will really come up often. And it does so for really good reason. They're trying to resolve the wound or trying to find a way to heal. What can be difficult about that is that the partner who might have inflicted the wound, whether that's intentional or unintentional, when we think about maybe the ways that a betrayal wound might apply, say, for instance, a partner being left vulnerable in a hospital, that kind of thing. What I find is that often the partner who has hurt their other partner feels a lot of shame. They
Mm-hmm.
often, and that's a really hard place to sit in as well. Like they don't feel happy about the harm often. And so they might inadvertently try to sort of move very quickly on from that and try to explain away their actions. And often I find, partners might sort of end up then in a cycle of, repeatedly sort of revisiting this wound. And it's like the metaphor that comes up for me, it's like, they're trying to walk on this broken leg and it's not really kind of cast right. And it's sort of hard to walk on and it's just kind of causing more damage and more damage to the wound that's already there.
Mm-hmm. So
Yeah.
it's
So,
like the current relationships, but I mean, I was referring to like whatever they carry from past relationships to present ones. If those
yes.
examples, as you said, happened to them in previous, then they're
Mhm.
becoming suspicious in this new one. Oh, I've dealt with infidelity in the past. So should I be
Yes.
suspicious of this person? Because they're bringing the wound to the new relationship.
Absolutely.
Or
Absolutely.
with illness. Like, hey, I already experienced
Yes.
illness with one significant other, and it was painful. Maybe I have that guilt or shame of not being present. Now I'm
Mhm.
bringing that wound to my current one. So yeah, that's
Absolutely.
what I meant about the emotional injury, being able to handle that and trusting themselves and their current. Like, these are two
Yes.
different. So do you see a
Yes.
lot of those
Yes.
patterns, or just kind of taking it from one to another person, or even to a friend? Like, I had friends betray me in the past. How am I
Mhm.
going to trust
Mhm.
this new friend? I actually,
Absolutely.
yeah, I'm sorry. I'm sorry, Brad,
Please
to
do.
interrupt, because
Yeah.
this
Jump
leads
in.
to my next
Yeah.
question, which
Yes.
you kind of already covered it, that people struggling with trust.
Mhm.
So, and creating those safe relationships. So, how do you rebuild trust after you experience those attachment wounds that you were talking about?
Mm.
Especially if this person that they have to trust is a family member. It could be a parent, a sibling, a relative,
Right.
or even a close friend.
Yeah. So I love the broad nature of this question, and I think it becomes quite nuanced because there's a few different ways that my mind sort of wants to think about that. So when I think about family, if it's an earlier wound, and where my mind goes to is um, there might be a lot of exploration needed around if the person's still wanting, like, thinking about a client's goal, like if that's about healing and repair, um, there might also be a piece that's needed to explore around, does this person have the capacity to repair with you? So when I think about, in particular, like where my mind's going with this is like maybe emotionally immature parents or narcissistic parents, then that answer might sadly be no. Like that at some point, even though that person really wants to have a relationship, it might then be a journey of the client then realizing about the limitations of that
Mhm.
particular relationship. And if that person can really give them what they're actually seeking. So, like, if we think about sort of maybe somebody who might be more of a narcissistic sort of traits or even rate of diagnosis, it's a bit like going to a desert longing for water and never being able to get that. And so
Mhm.
sometimes it can be about also moving towards acceptance. That said, if that's not the case, then I think what is probably needed is, back to what I was sort of touching on before around those components, is a genuine sense of remorse, a genuine
Mhm.
sense of accountability, understanding that deeply understand the impact that I've caused you as a person, right? Like, and for that person who has endured that injury to really feel that, like to really have the felt sense, oh, they get it. Like they really get it and they really want to change this. And so I think on top of that, for forgiveness, there also needs to be, I think the person who's been injured really does need to know that the person has some proactive plan around how this is not going to happen again, or they're going to reduce the risk of that ever kind of playing out again to help them start to feel safe. And then I think um, the old saying goes like time and patience as well is needed. So sometimes the person who has injured the other person may want to speed up that process, may want to kind of push the process a little bit because it's probably hurtful as well to sit in this place where you feel like and know that you've caused someone a lot of harm. However, I think it is really important for that person to not be rushed in their healing process, to not be rushed to forgive too quickly, and that time and patience is needed. And sometimes that's also about having small and repeated experiences of, oh, I can trust you. Like I can start to dip my toe in this sort of pool of vulnerability here. I can start to lean into that. And yeah, that does take time and repetition.
Okay, because yeah, it does sound like you were talking about when you experience the attachment wounds with the person and
Mhm,
recreating a new relationship with them.
mhm, mhm.
But I was like suggesting, which that's good. That was very informative information. But what if it's like somebody new? Like, you're carrying those wounds from past friendship or past relationship or past
Yeah.
dynamic, and you're carrying it with someone else, but you're still like, oh, is this person's going to be like the narcissistic, like I knew over here on this side that I'm no
Yeah.
longer communicating with. Now I have, but you're still
Yeah.
thinking about that, and that now you
Entertaining.
have to
Yeah.
with the new person.
Yeah. I appreciate you helping me orient here a little. And I think that, that does happen too. Again, when we think about trauma, we do continue to carry that unprocessed pain until that's worked through. And so I think, for that person who might be then experiencing that in that relationship, it can be really helpful to engage with therapy with a trauma focused therapist that really understands that maybe narcissistic wounding, that can help you to start to first of all establish safety within your own being, because it's hard for healing to happen until the body starts to feel safe. So we can't talk
Yes.
ourselves out of trauma as much as we'd love to think
Yeah,
that we can. We can't, unfortunately. So we do
absolutely.
really need, yeah, that person does need to start to feel safe,
Hmm.
within themselves, within their body. And part of that is also about emotional regulation. So being able to have like a wide range of tools, being able to regulate. And what happens with people who have had really any form of trauma is their window of tolerance, so the optimal bandwidth of stress-based arousal that we can kind of remain regulated and at baseline and still tolerate moments of everyday stress, is
Hmm.
really reduced. So that's really
Yeah.
quite narrow. And what will typically happen, as you're touching on with that example, is if somebody's had that wounding and then goes into a relationship, there might be this kind of trigger, like as in like any sort of smell, situation, sight, sound, some kind of stimuli that then induces that implicit reminder of the trauma. And so for the person who has been injured, sadly, they're just flooded with that feeling of being incredibly unsafe in that moment, and the trauma feels like it's happening all over again.
Yeah.
So I, yeah,
No, it's,
so
oh,
I
I'm
think there's
sorry to
like,
interrupt. Go ahead.
oh, I was just going to follow up. I think so. I think there's a few layers there around the
Hmm.
healing, and I think it is about sort of regulation tools, and also I think it would be really helpful for the partner as well to have some trauma-informed psychoeducation around what's happening for the partner to sort of hold space.
Yeah, that makes
Yeah.
sense because, obviously you're coming into this together and sharing that information and working together. And I like how you mentioned triggers because if you're in an emotionally, strained relationship and maybe there's some things from the past or a traumatic past or different situations from the past presents itself in your current relationship, and before it creates conflict, spirals into
Mhm.
conflict and distance with this new person because you're
Mm.
bringing past trauma into the new. So,
Mhm.
how can you respond to some of those triggers? I mean, I know obviously therapy, as you're seeing a therapist.
Yeah, I
Mhm.
love this question. Again, there's a couple of layers here, and I think being able to understand one's own triggers, being able to understand, first of all, like what is happening in my body, how that past is then coming into the present, and recognizing when the triggers play out. So, first of all, being able to disrupt that trigger, start to regulate, start to give yourself the space to be able to regulate, whether that's through some breath work, grounding, mindfulness, being able to sometimes remove yourself from the triggering situation for a moment to help you regulate as well. So there's a whole range of different tools and things that can be really helpful for that. I think being able to identify your emotions as well. So being able to identify how that feels in the body, like what's the meaning making that comes up from the trigger as well, like what's the story the mind's wanting to pull you into, being able to gently challenge that as well. Like, because sometimes, like when we think about trauma, and rightfully so, so valid, right? Like our nervous system and brain become so sensitive to any kind of reminders of that pain, and wants to prevent us from ever experiencing that again. So it's almost as though like we have this really sensitive smoke alarm that's kind of really hypervigilant. And so
Mhm.
it is about slowing all that process down. Um, And I think, I'm sorry, can you remind me a bit about the question? I think you were sort of asking a bit more about then in that con current relationship. Is that what you're sort
Yeah,
of saying?
like in the
Bringing,
current and the new, but you're bringing past traumas with you in the current, and maybe
yes.
that triggers you in the current, and then it creates conflict in your current ones because you
Right.
can't
Yes.
control that trigger. And so you're presenting distance with this new person and anger.
Yeah. Yeah, thank you. Thank you for helping me
Oh,
remember.
yeah, no
Um,
problem.
I really appreciate that. I guess what else the other piece that kind of comes up for me is of course we need our current partner to be, have lots of green flags to hopefully be able to respond in a really empathic, responsive, validating way to the person's pain that's coming alive. And so
Mhm,
I think that what would be really helpful if it is a safe relationship, and the person is very supportive and understanding of the partner's previous trauma, is to be able to help that person also heal, because like healing happens also in connection too. So like
mhm,
connection is also a real beautiful antidote to, help us start to feel safe again. And I think like the partner being able to hold space for that person who has experienced the trauma to start to lean into vulnerability is really helpful. So that might be like just an example that comes to mind for me. That might be the partner being able to feel safe enough to go to their partner and say, hey, I don't know what's actually happening right now, but the meaning that's coming up for me and what I just saw there is I noticed a lot of fear come up for me. I
mhm,
noticed a lot of fear came up for me when you put that phone down as I walked through the room, and I'm just going straight back to that place where that person really hurt me and did and betrayed me. Like say if we stay with the betrayal scenario. So like being able to talk about that in softer ways and really have the partner respond,
mhm.
not in a defensive way. So, like, if
Yes.
the partner can't do that and they do respond reactive and defensive, and maybe they criticize the partner, you just need to get over it, or sort of, maybe say something that's harmful and unhelpful. Then it's just kind of adding salt to injury.
Mhm.
So it is going to impact the relationship then, and the bond will erode as well.
Exactly. That would be a whole different question if the person is kind of like dismissing, being dismissive, shadow
Yes.
banning, or making it seem like, oh, it's unimportant. But open,
Yeah.
supportive communication, as you stated, is the most important.
Yeah.
Once, if these trigger wounds do show up in new relationship, you have to have that. Or
Yeah.
else then there'll be problems with that relationship
Absolutely.
too, right? But
Yeah.
I
Absolutely.
know there's one form of therapy that you use. It's called emotion focused therapy, or EFT.
Yes.
And the understanding is that it's supposed to help people repair and strengthen bonds, not only in their romantic relationships, but close relationships. It can be with parents, with their
Mhm.
children, siblings, close friends. Can you
Mhm.
explain more about it?
Thank you,
What
Tanya.
it
Yeah, I'd
is?
love
Uh-huh.
to. So EFT is very evidence-based. It was first founded by Sue Johnson, Dr. Sue Johnson, who sadly
Mhm.
passed. It's backed by 40 years of attachment science and research. It really started out in the couples sphere. So there's three different streams. So there's EFCT, which is emotionally focused couples therapy. There's
Mhm.
also emotionally focused individual therapy, and there's also emotionally focused family therapy. So there's three
Mhm.
different streams. I personally don't, work with families. My focus is individuals and adults and couples. But that said, I think it's incredibly helpful across all fronts. I think it can differ with those streams a little bit about the approach, but going circling back to maybe that with in terms of couples, as a couples therapist, it's very experiential. So we don't teach clients communication strategies top down. We help them have a different experience with each other in the room. So the therapist is very attuned to tracking and reflecting with the clients. Where do they get stuck? Like, where is the protest coming alive? Meaning, like, what are our prickly places, frustration, anger, defensiveness, maybe a partner's becoming a bit critical of the other. And we slow it all down and we help couples to feel really super safe with a lot of curiosity and compassion. We start to help their partner to regulate through the protest. And underneath the protest, a lot really softer needs, fears, and longings. What we know about unprocessed pain is it tweaks our behaviors. And so we can then, that fuels the protest, and we can find ourselves kind of getting caught up, our emotional signals scrambled. And that just kind of leads us to places where we feel really misunderstood, disconnected, and alone. So I think the beautiful thing about EFT is as couples learn how they get stuck in what we call the pattern, the cycle, they start to disrupt the pattern to slow down their protection
Mhm.
moves, whether that's criticism or defensiveness or blame or whatever that looks like. And they start to be able to lean into, making vulnerability safe. So being able to share with their partner in softer ways. It's not about not talking about these difficult and challenging conversations, but how do we do that in a way that promotes connection, that strengthens our bond, that helps us to feel more connected? And so when the way that we think about it is vulnerability to vulnerability, like that's the good stuff, that's the glue, that's like the medicine in the bond. And so over time, as couples do that, particularly in stage two, there's what we call the change event for a particular dyad. And through that, couples really do start to take on what we call a positive cycle. So
Mhm.
they start to navigate, moments of conflict and disconnection in new ways that really helps them to stay together and helps them to stay connected.
Okay, so it's just more of like giving an open space to them to feel their emotions in a safe environment, right? Not to be
Yes.
shameful of them, and how to
Yes.
communicate them with their partner in a healthy way
Yeah.
instead of like anger or just like attacking each other, suppose, or
Yeah.
so is that basically
Yeah, that
what it's
is.
about?
Yeah, absolutely. You're spot on. And I guess the other layer I want to add in here is when we do get to stage two, it's quite vulnerable work. So we
Hmm.
do actually, the frame I want to put around is a kind of a form of inner child work. We help
Okay.
partners to realize that it is younger material that's being touched in these places that drives the protest. And when partners really start to bond in this really beautiful, very safe, vulnerable place, that it really it's beautiful, Tanya. Like their hearts open. There's so much empathy in the room. It's very moving to witness, to be fair. And so yeah, as I said, to sort of circle back, vulnerability to vulnerability is really just like that's the medicine in the relationship, and it really helps people to sort of metaphorically drop down their swords, and their guards around their hearts and to start to open their hearts up to each other again.
Okay, so that's what's mostly based on. And is there a certain number of sessions or it's something that's continuous that you practice
That's
in
such a
therapy and outside?
Yeah, such a great question. I guess I'm trying to think of the number. I know it's up and around maybe 24 sessions. Don't quote me, but there's a specific number, I suppose, that of the treatment model itself. I don't really think about that too much because I think it's dependent on the couple. And so
Mhm.
some couples I've had for 2 years, other couples might really get some good traction, may not even go to stage three because that can be a choice around the couple. They may feel like they've done enough after the stage two event. It just really depends. And it also depends on the ingredients of the couple. So like some of the great ingredients that we really need for the therapy to be really effective is are they willing? Are they open? Can they acknowledge with accountability? They're willing to own their part. Really willing. Do we most importantly, do we have emotional safety? Like is the relationship safe? That's an absolute necessity. So we really do need to have a lot of really good ingredients to get us off to a good start.
And what was stage three again?
Yeah, thank you.
It
That's
was
what we call like integration. So it's like really where it's more of a meaning making kind of stage where we're really reflecting on the process as a whole and the couple's journey throughout the therapeutic journey and helping them to make sense of it and to really kind of integrate and establish that positive cycle so that we're putting them in a really good position to transition out of therapy.
Okay, and as we continue, speaking of all this relationship dynamics, and if someone, for instance, is feeling emotionally disconnected from a loved one, again, it can be anyone, and they want to repair that bond with someone, where is the best place for them to start to have this difficult conversation with the person?
Mm. Yeah, there's a few pieces that I want to kind of put in here, and one thing I would suggest is um, I'd like to invite the person who might be considering this and might really resonate with this question. How am I feeling in terms of having this conversation with my partner? Like, do I feel like I'm in a place where I'm regulated, I baseline myself, and I can say this in a softer way?
Mhm.
Or am I more feeling quite prickly and protest and I want to just tell them all the things that they're doing to hurt me, and that might come out really pointed because
Mhm.
when we approach it from that position, it's really highly likely that that person is going to get defensive and they're probably going to maybe respond in a way that just ends up in a kind of interactional pattern again, sort of coming alive. So I would like to ask the person to maybe consider like, how do I feel in my body? Do I feel calm and regulated? Like maybe there's a piece around the language. So how am I framing my hurt places? Like, what does that sound like? We know like when we tend to maybe approach this with like you always do this and this, like when we start the sentence with you, like that automatically kind of takes us to a place of feeling quite defensive and like we have to
Yes.
defend our position. So I'd also like to put that piece in there. The language does matter. Like,
Hmm.
am I talking more about my feelings and my softer hurt places? And yes, of course, like the example of how that's occurred, but in a way that maybe I'm inviting my partner into a dialogue where they can kind of hear the impact, whether that's a partner, sorry, friend, or whatever the
Hmm.
loved one connection is. Um, and I would also think about timing, like what is the, is there a time where the partner is open, receptive,
Hmm.
um, able to take it in. So if they're also quite distracted, overwhelmed with work, and they're a bit frustrated, that may not be a time that's really conducive to lend itself to a healing moment. What's the environment? Like, do we have a great safe space to really unpack this together? So there's a few elements there that I'd probably, really invite that person to think about that really, my hope is to sort of set them up for success if they're thinking about sort of, approaching a conversation like that. But I think I statements can be really helpful. So, like staying with your own feelings and how you feel and what hurt your heart can
Yes.
be really helpful to help that person take that in a non sort of defensive way.
Yeah, I mean, those are very good points. And I like how you pointed out self-awareness is number one. You have to kind of be at peace with yourself, for
Yes.
instance, before you
Yes.
start these conversations. And you have to understand yourself very well and in order to break these patterns. So, how can someone start building this self-awareness in day-to-day
Yeah.
interactions instead of choosing, as you said, they might become defensive, like they want to start a conversation or an interaction, but they know their trigger points and they just know that, oh, I don't know if I can do this. How can they start being self-aware?
I love this question. I really love this question because I think what's really common is we do tend to have pain and then go other focus. So, meaning
Mhm.
like, if I can just get that person to change, then I'll feel okay. And that's what's needed. And yes, that might be a part of it. And there's something tender that's being touched within me that's really kind of driving that pain as well. So, what is the tenderness that's being touched there? Sometimes that may not be known to the person that's even being triggered at the time.
Mhm.
So I think there's a piece needed around self-regulation and maybe know not everyone loves journaling, but I think it can be helpful to give us some distance from very distressing emotions, to put it to paper and think about, okay, when did I first started to notice those triggers within me? Like when did I first start to feel flooded and really angry or even rageful? Like what was coming up within me? Like what did I notice about my thoughts? What was the feeling that then came up within me? And I think with feelings that can be, a whole piece of kind of learning and self-awareness in itself. Like if we haven't had that experience in early years of that modeling and attunement from a parent, it can be very hard and confusing
Mhm.
to put feelings to words. And so, another great tool that people that might be listening to your podcast could access probably from the internet would be a feelings wheel. And starting
Mhm.
to really just notice, like, what are your body sensations through different feeling states? Like, what do you notice about how that information is sort of coming up in your internal experience? What do you notice about the story that the mind creates around the feeling? Like, what's the
Mhm.
story telling you? How does that story land? Like, is there another way, that another perspective that might be brought in that might offer you a more balanced view of that story? So sometimes, as we know, thoughts are not facts. They're a lot of, have lots of thoughts all the time, but what sometimes tends to happen is the story that we're experiencing in the pain of all of that is our internal truth. And
Mhm.
so sometimes we might find ourselves kind of in a certain particular perspective of looking at things, when maybe we can find a great deal of comfort in bringing in these different perspectives that may not also be looked at. Does that make sense?
Yeah, it does. And I like the point that you made. It could be upbringing. Maybe you were in a cold environment where you weren't allowed to express yourself, which it
Yeah.
wasn't good to be sad. It wasn't good to show anger. It wasn't good to be vulnerable I mean, then you think that's okay. That was the norm for
Yeah.
you when you're an
Yeah.
adult, and it's kind of hard. Or as you pointed out one time, dealing with narcissistic parents,
Yeah.
perhaps. I mean, I've seen that with adults. It's created a lot of difficulties. I mean, they could be in their 30s or 40s, still thinking about their narcissistic parents.
Yeah.
So, yeah, so
Yeah.
a lot of that maybe kind of restricted and made it more difficult for them, as you said, to connect with these feelings, to make it okay.
Yeah. Yeah.
So that's good.
Absolutely.
You said the feel. Where is this? The wheel? You said the
Oh, a
feeling. The
feelings wheel, emotions wheel.
Felix. Oh.
There's a lot, like even if they just pop that in Google, I'm pretty sure they'll get like multiple different versions that might come up. Um, yeah, and so like a process that comes to mind for me in being able to sort of distill maybe their own emotional experience is there's a few points I might suggest that might be really helpful, is like what triggered the difficult feelings. Rarely people probably want to do this when there's a happy joyful feeling, right? Like we're just
Yeah.
in the moment, really present and connected. So I'm leaning into more difficult feelings here. But so what is the situation? Like what is the trigger? How did I experience that in my body? So that would be the next point, is what is the body sensations that are sort of making themselves known to me? What is the feeling that I'm feeling in this moment about that? Like, so do I feel defeated? Do I feel irritated? Do I
Mhm.
feel hurt? Like, am I embarrassed? Like, so there's a lot of different feelings, and some of them are quite nuanced, meaning like
Mhm.
it can take some time to sort of figure out, well, okay, well, I think it is more this for me in my experience. And then again, just coming back to like, what's the meaning making, right? Like, what's the story that's kind of coming up, being sort of birthed from this experience?
Mhm.
And how is it shaping my response? What am I finding
Yes.
myself wanting to do with that information?
Hmm. Yeah, it's all, yeah, exactly. The stories that you have that are just like the memories and repetitive, right?
Yeah.
That you're like facing. And another really important question, because this happens to many people when reconciliation is not possible.
Mm.
They could be estranged from family members, or, it could be for safety concerns or just wanting boundaries with certain people because they're toxic. It could be a close family member, like that's it.
Right.
How can somebody heal from attachment injuries when the other person is no longer in their life because they shouldn't be in their life, for
Sure.
certain
Thank you.
reasons?
Yeah, and this is also something I commonly encounter, so thank you for bringing that up.
Hmm.
Um, where my mind goes to as a therapist that really loves EFT, that's probably where EFIT, like emotionally focused individual therapy, can be really helpful. Now, that said, like I also really appreciate ACT. So that might be some grief work, ACT, and there might be a sort of integrative approach there around, boundaries and perhaps DBT. So there's a few different models that I might sprinkle in or draw from. I always
Okay.
let the client lead me around what's going to be most resonant for them and what's going to work for them rather
Hmm.
than trying to fit them to a model. But I guess where I want to lean into is when I think about emotionally focused individual therapy and attachment injuries. I think emotionally focused individual therapy can be super helpful because often those that may have had those experiences, emotions have not been safe. It's certainly not been
Hmm.
safe for me to feel them. I haven't been held in them. And, emotions might feel scary and frightening and overwhelming. And so I think with the therapist, through somebody working with them individually, tracking and reflecting and offering and being compassionate in the room and helping them have that experiential um, moment. It then
Hmm.
is internalized within the client or the person that's doing the work, and they get the felt sense of compassion. Because often, sadly, those that may have had that experience tend to blame themselves. Like they tend to have this sort of deep shame, which can be really sticky and hard
Hmm.
for the client to shift in a therapy. And so, the thing I love about emotionally focused individual therapy is you don't physically need that person in the room. But what we do with a lot of safety, and when we move into a place in the therapy that this is where the client's at, is we do what's called as enactments. So
Hmm.
we help the client maybe be able to put words to how they feel and what they needed to say to that person or what was needed in that particular dynamic for them to feel seen and heard and acknowledged in their moment of pain. And so they can still do that without the other person in the room. That does often involve, guided imagery, which is very powerful
Hmm.
in terms of how we heal within. And so we might do like an enactment with their younger self. Maybe they're
Hmm.
going back to the scene and they might be offering their younger self the response, which, like if we go to the literature, that's what we call reparenting,
Hmm.
reparenting the younger self. And so they can
Hmm.
heal. They absolutely can heal. And I've just had the good privilege of witnessing that firsthand in the work that I do with very brave humans every day. I see them shift out of impossible places, and it's really beautiful.
Oh, yeah. I mean, yeah, that's amazing, that people are able to do this. And of course, it's like an ongoing process. Like I say, mental health is a daily practice. And
Yep.
so, if Brad, if you can offer one hopeful message, like for someone who feels their relationships are always will always be shaped by their past trauma, what would it be? One or more message. I mean, you've already shared so much. It's kind of hard to
Thank you,
ask. Can you
Sarah.
share something else?
Of course, yeah, I'm more than
No.
happy to. And I think this is one of the most important points, right? Is how do we lean into hope in impossible places? And I want people to know that when we have the story of I am broken, it's just a story. Like it makes a lot of sense that we have that level of shame and that we're sort of having that the metaphor of a shadow kind of follow us around like
Mhm.
that. But we also have a lot of agency and power to heal. And I want people that are listening that to know, from my point of view, you have absolutely everything you need to heal.
Good, good. That's, I
Everything within you.
mean,
You have everything you need. Absolutely.
yes.
And so having the courage to whatever professional you're engaging, finding the right fit, someone that can really help you feel safe and seen is, that speaks to your resilience, that speaks to your strength as a human to continue to strive through adversity. And so I just want people to know that. Um, yeah.
Yeah, that's an incredible message and very good motivation. And also, Brad, if you could please share if you have any social media channels or website, and I would put it in the
Yeah,
description
sure.
too.
Yeah, so my website is www.phoenixconnectiontherapy.com.au, and you can catch me on Instagram. I'm not really on a lot of other socials. Instagram's kind of that for me. So just my handle is Phoenix Connection Therapy. Yeah, they can find me there. There's lots of kind of helpful posts, and I try to just bring my passion to the page and share community awareness.
Okay, well, Brad, I just wanted to thank you so much. You've offered so much valuable information, and I appreciate you being here. Thanks so
You're so
much.
welcome. You're so welcome. Yeah, it's a pleasure.
Um,
Lovely.